We have been dealing with COVID-19 for over 2 years now. By some accounts, most people in America have had COVID-19 at some point or another. For most people, mild or moderate symptoms last about 2 weeks, but others experience lingering health problems, even when they have recovered from the acute phase of the illness. Specialists are seeing a spectrum of symptoms after acute COVID-19, some of which would be expected after other critical illnesses. Some are minor issues, but other people may need continuing care and even readmission to the hospital. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. What happens when COVID-19 symptoms don't go away? In some people who recover from COVID-19, lingering health problems can wreak havoc for quite a while. Amy Den is a physical therapist with UF Health and their COVID Restore program. She's here to shed some light on that. Hi, Amy.
Good morning.
Tell us, first of all, the definition of long COVID.
Long COVID is when the person has technically gotten over their acute infection or acute hospitalization, but yet they still have lingering symptoms. So those symptoms could be anywhere from days to weeks to months to even a year. I've seen a patient that still have these symptoms that are hanging around and really cause a lot of debility and wreak havoc on the patient's life.
So can you tell us what some of those symptoms are? What should we look for?
Yes, they are really wide ranging and can affect virtually any organ system throughout the body. The most problematic ones we see, or the most common ones we see, are a profound fatigue. That certainly can limit the patient's daily activity. It typically can also be not necessarily related to what you would initially think would be a fatiguing type of activity. One of the most frustrating things is even mental or emotional activities such as paying your daily bills, dealing with complex social interactions. Those actually can be a fatiguing factor that can lead to this profound malaise that can last hours to even days or maybe even weeks after the exacerbating trigger.
So
Another one,
go ahead.
sorry, the other two most common symptoms that we see are people that have breathing problems afterwards. So that could certainly come in the area of being short of breath, feeling like they just can't get enough air in, just feeling very anxious about their breathing, and certainly could also be showing up in their reduced oxygen capability. So their oxygen saturations can be reduced, and also have the patient have to be on supplemental oxygen for a time period.
So
The
do
last
these
one,
symptoms, I want you to answer that, but do these symptoms get confused with other things?
they certainly can. I think the most frustrating thing, people that come to our program for the first time, is the most frustrating things are these are symptoms that you think would recover with rest, particularly this profound fatigue. It should recover with rest or sleeping, napping, and that typically is not the case. It's not restorative with the normal activities.
Okay, you were going to tell us the last symptom after the breathing issue.
Yes. Brain fog is the other one that, again, this is another one that we wouldn't necessarily always think that would be related to, say, maybe a COVID or pulmonary infection. But this just shows the far reaching capability of that COVID infection, that it can actually affect your brain, your thinking, your memory, concentration, attention span. which is very debilitating for patients.
So here's where we learn about COVID Restore. Tell us what you do in this program.
So we have a multidisciplinary program that is headed up by our physiatrist, and that's Dr. Astores. And she is a physician trained in physical medicine and rehabilitation and also integrative medicine. The wonderful thing about Dr. Astores is we almost liken her to kind of the hub of the wheel. So she takes the patient, looks at them holistically, and then can refer off to the spokes. So rehab can be a spoke. We offer physical therapy for patients to improve their overall endurance, their strengthening. We work on breathing training techniques for those having difficulty with breathing, aerobic activity.
And
Occupational therapy is another spoke of our wheel, and OT can see the patients, particularly the patients that are have smell or taste loss with the COVID infection. If that is persistent, OT can work on some scent training or smell retraining to help
oh,
with that.
oh,
Help
cool. So how does someone qualify to be a part of this program? Do you need a physician's referral?
Yes, so if the physician will refer the patient to our COVID Restore program, and the patient can call the wellness number and make an appointment, and then they will initially get scheduled with the physiatry team to be evaluated. Then the physiatry team will refer out to the extra ancillary services.
Have you had enough of these patients come through that you can put a beginning and an end in terms of how long the process of therapy takes?
We can't really predict how long each individual will take to recover. That I think is probably one of the most frustrating things about long COVID is that we have a lot of experience, and our team also has networked nationally and internationally with other centers who are specializing in treating COVID patients. There's really no textbook example for how fast someone will progress. Will they progress? But what we do know is with the program, symptoms can at least be reduced and then hopefully resolved with time. And it really is that time frame that's difficult to pin down.
Tell us about one of your biggest success stories.
We had a young lady who was a hospital worker. I'll leave it general like that. She was young, didn't really have any other medical history, and presumably contracted COVID while on the job and ended up on the ventilator, very, very sick for several days, and eventually was weaned off the ventilator. When she first came to my clinic, she was extremely short of breath. She really couldn't talk and walk or exercise at the same time, required a lot of rest breaks, and she was just really emotionally beat down because this was 6 months after she was released from the hospital and she was
Mm,
still having these respiratory symptoms. Being a hospital worker, it definitely made it very acutely aware to her that
sure.
her respiratory was impacting her life. However, with therapy, she got to where she was walking on the treadmill, she was lifting a lot of weights, and she eventually, by the time she graduated from our rehab program, did go through the return to work program.
So tell us about that program, Return to Work.
So the different patients, depending on what their job activities are, some of them the work activities will have specific criteria. For instance, I've had a policeman who, for his return to duty, they had extremely specific, both strengthening, strength type activities,
Hmm.
as far as push ups, sit ups, as well as jogging activities that the patient would have to do. So, our program can certainly mimic some of those things, have the patients go ahead and practice that as they're coming closer towards their return to work.
So walk us through what happens after there's a referral and people call you. What is the process like?
So when they get referred, they will go through the COVID Restore Clinic with Dr. Restores. They can provide both primary care physician services as well as the more specified integrative medicine. So with the integrative medicine team, Dr. Restores, both before the appointment, will send out a pretty extensive battery looking at symptomology, their fatigue, how this is impacting their life. And then during the appointment, she has a very extended appointment with them for at least their first session to go through this battery of their symptoms, what has been working, what has not worked, and then she will tailor the treatments to that. So someone who's having musculoskeletal pain could be referred to acupuncture and physical therapy. Someone with profound breathing issues could be referred to physical therapy. The patient that is still having difficulty with their nutrition because they are unable to smell and taste, or things are very altered with their smell and taste, they can go through occupational therapy to do the smell retraining. The patients that virtually all of them, I would say it was situationally pretty typical for patients to be depressed going through this prolonged kind of chronic illness. They have a program with the clinical psychologist that they will get weekly web-based or Zoom kind of meetings to work on anxiety management, pacing and breathing, relaxation techniques, and ways to improve the patient's mood and motivation.
So this really is an holistic approach to helping people, if not recover fully, at least be able to handle what's happening in their lives after COVID.
Yes, very much so.
Do you find that people are more open to talking about the emotional stuff than perhaps they used to be?
I really do, because when the patient comes to see us, I think their largest frustration is these symptoms are kind of soft. There's not really ways to say, oh, you've injured your leg is swollen. This is something that's internal with the
Sure.
fatigue, with the shortness of breath. And I think just coming into the clinic and having multiple clinicians validate that what you're feeling is typical. There are a lot of people that have experienced the same things. You're probably not going to experience all the same symptoms as somebody else, but what you're telling us is very common.
So,
Just
so it sounds like letting them know they're not alone is a significant part of the COVID Restore program. Amy, thank you so much for shedding light on this, and thank you for all you do to help people get back to some semblance of normal. We appreciate it.
thank you for having me.
And we will be back right after this. On August 11th, 2021, Fabian Granado was hospitalized for COVID-19. He was unvaccinated. Doctors placed him in a medically induced coma. For the next 7 months, he fought a grueling battle for his life. His father by his side throughout the whole ordeal. In February, they both walked out of UF Hospital in Jacksonville, the first steps in a long road to recovery. And they are joining us today. Hello, Renee and Fabian. And Fabian, congratulations on being on the road back. Tell me, what did it feel like to take your first steps back in your house in Texas?
Well, not quite home yet, but I am in Texas. And first steps back in Texas, amazing. Finally on great grounds and able to breathe this Texas air, which is always nice.
Well, Renee, we can see the smile on your face. What has it been like? Fabian turned 28 right after leaving the hospital. I guess that is the best birthday present any parent could have, especially given the situation. What was that like for you as a parent to kind of be there day after day and not really knowing what was going to happen?
It changed throughout the course of this ordeal. Of course, when I went down there, I went to Florida being told that my son was going to pass away. And as a parent, that's the worst thing you could ever go through. And sitting by his side every day. And when I went down there, I knew I am not coming back home to Texas. until this is over,
And that's
one way or the other.
That's what parents do. So Fabian, how are you doing right now? Tell us what your health is like right now.
Yeah, so I'm in good health so far ish. Um, I have trouble breathing when I walk around the house. Get winded very easily, and it's it's a struggle. You know, not to say a struggle, but every day I'm huffing and puffing, trying to catch my breath, trying to get back to where I was, and that's just going to take some time.
What
But
would
other
you
than
Well, what would
go
you
ahead.
say to people, because we said you were unvaccinated. So what would you say to someone now that you're on the other side of this, or you're on the road back?
To be honest, it's your own personal belief, whatever you believe. I wasn't vaccinated. I was too stubborn, knuckleheaded, and for me, now that I look back on it, kind of wish I would have got the vaccination. You know, it would have been a lot easier on me had I did, less expensive, and it was my own choosing, saying I'm invincible.
Well,
So
you brought up the question of expense. So Renee, let's just go there. What
Okay.
kind of financial toll has this taken on your family?
So far, we've been blessed, overly blessed. We've had family members, friends, people we don't even know around the Texas, Florida, around the world. We've received funds through GoFundMe, Venmo, and all other types of apps, and people have really helped every step of the way.
Did insurance help at all?
Yeah, and this is where we received even more and more blessings because Fabian was going to trade school. He was in between jobs, did not have insurance. And I don't know what the bill is. We haven't received it yet, but I'm sure it's going to be in the millions. We were fortunate enough to get Medicaid to help pay for the bills. But even beyond that, I'm sure we're going to still receive a hefty bill. And we get back home, we're going to have more expenses. And that's yet undiscovered what's going to happen.
Okay.
But we'll face those challenges as they come. My son's alive, and we'll worry about the money part later on.
Yeah, you can't put a price on having your son right there next to
Never.
you.
No, there's no price.
You chose to document every step of his journey from the ECMO machine sending oxygen to his lungs when they induced him into a coma, to his first steps on his walker surrounded by medical staff, and the removal of his tracheostomy tube. Why did you decide to share every single stage of this journey?
Very early on, and I knew that if Fabian was going to be saved, we needed prayers. We needed people praying for Fabian and so that we could all join our voices together, raise them to God, and Lord, hear our prayers. And I knew one way to do that is to share, to ask people to pray for us. And I found that when I started posting information, more and more people joined. More and more people were praying. And every day I posted new pictures, it drew more and more people in.
So, what has this done to your faith? You're obviously a man of faith. How has this ordeal impacted your faith?
My faith has been stronger. It gets stronger almost every year. Being a police officer, I know how strong faith is. And it has really grown my faith even that much stronger. But more importantly, it's brought so many other people into it. We've actually started, well, not we, God has started a ministry around Fabian through this. And it's drawn in thousands of people to pray and talk to God who wouldn't have talked to God as much as they have been. And of us talking together, sharing this together, and we're God's children, and He really wants us to be together and get along. And this has done an incredible job to bring people together, talking to God for a common goal. And I've
How,
seen this go ahead.
how has this impacted the way you parent him? Because, when they're little, you check on them every night just to make sure they're breathing. And I understand you've gone back to that practice. Tell us about that.
This is like starting all over again with a baby. He couldn't do for himself, having to feed him. Of course, I wasn't changing his diapers. The great staff at UF Health were doing that. Um, but yeah, it's like starting all over again, feeding him, checking on him, making sure he's awake, breathing. And now that we're home, like you said, first night and still to this day, in the middle of the night, I'm looking at him, looking to see if his chest is going up and down, listening to see if he's breathing. Sometimes I'll even bump the bed or touch his foot just to see if he'll stir and see if
Yeah.
he's still alive, just like when he did when he was a baby.
So, Fabian, how has this impacted your relationship with your dad?
It's brought us closer together. You know, my dad, he's being a police officer, he's always at work. And so, I didn't get to see him very often. But when I did, we always hung out. And now we've been hanging out all the time. So when he goes back to work, it's going to be a little bit different, but we still love each other. We're great together.
Yeah, well, next time, try not to do something so dramatic to spend time with your dad. We can send you some creative ideas.
Yeah, when he was little, he would cry. Every time I left the house, he would cry, wanting his daddy to come back home and spend time with me. So, yeah, this is a very creative way for us to spend
Yeah,
time together.
we're gonna figure out another way for that to
We'll
happen.
do it a different way from here on out. I'll retire and we'll go spend more time together that way.
So, if you had some parting words to say to someone who's listening to your story and being very grateful that you're here, because as you said, you didn't expect to come back to Texas with your son alive, what would you say to people?
Look, whenever you're going through any kind of tragedy, this is the worst tragedy most people can go through. And as a police officer, I've seen a lot of horrible things, gone through some horrible things, had to do some challenging things. I've been through divorce and everything else. All that pales into comparison to losing your child. I couldn't fix my son by myself. There's no way I could do this by myself. So I had to lean heavily on my faith, on my belief in God. I had to lean very heavily on that one. And if you're going through something tragic, you want help, you've got to start praying for it. You've got to start asking God for it. But here's a point where it really changed, because the beginning of this process, when we felt like Fabian was going to die, past waiting time, I kept praying and praying and praying for God to save my son. That was what I wanted. But I found that what really made the difference was when I changed my prayers to, okay, God, I want your will to be served through us.
Well, thank you both for sharing your story with us. Fabian, we hope you continue to make even more and more strides as the days go by. Renee, we are happy that you had your son back with you, walking back into Texas. So I know how scary that can be as a parent, and we really appreciate you sharing your story with us.
You're welcome. Fabian may not have said it, and that's his choice. I will say it. Go get your vaccine.
And we
Go
will let that be the last word. Thank you both, gentlemen.
Good morning, man.
And
welcome.
we will be back with more. Stay with us. Maritza Sons established a legacy of service to Central Florida's Hispanic community during more than 20 years of service through Latino leadership. Everything changed in the summer of 2020 when she was hospitalized with COVID-19. Today, long after waking up from a coma and learning how to walk again, she still battles with the long-term effects of the disease known as long COVID. Maritza joins us today to share her experience and how it has strengthened her resolve to continue helping others. It is so good to see you.
Wonderful to be here with you.
Thank you for sharing your story with us. First of all, why would you do this? Why not keep it private?
I think that I am compromised with my community. And what I want to tell people, if it happened to me, It can happen to you. You have to be careful. You have to take care of yourself. And that was something that for my family was very hard because when I was in the hospital, they kept everything in secret. Nobody knew that I was in the hospital. My husband said that he did it because he didn't have my permission to share with people. So everybody was crying in the house quietly. I was supposed being in the hospital because I had pneumonia, but nobody knew that I was totally out. I was in a respirator and I was in coma at the same time. So they couldn't see me. That was something that
Because that was in the days before the vaccines, when
Exactly.
we didn't know very much.
Exactly. That was the time when it started. That was the summer that everybody was having. I don't remember when my husband took me to the hospital. I know.
Still?
No. I don't remember. I asked him and my daughters about what happened because I don't remember anything.
And how long of a time span are we talking about that you have no memory of?
I got into the hospital the first week of June, and I was back. I opened my eyes and I heard voices and I saw people in July 1st. That was when I think that I was born again to this world. I was still at the hospital, but that was the day that I woke up, that I realized that I was in the hospital. I thought that I was in Canada.
You thought you were in Canada? Okay. Why Canada?
Because it was at the Advent Health in Rawlings, and from my room you could see a big construction thing with a flag, and it was a red flag, and I told the nurse, I said, who brought me to Canada?
Oh my goodness.
So everything, it was like a process of, it was born again because I didn't remember how to use a cell phone when they told me that we can
You could make calls, yeah. Someone had to teach you how to use a cell phone.
The nurse teach me. I was in diapers. I was like a piece of jello. I couldn't stand still. They have to put me wraps to sit me up.
And you had to learn to walk again.
To walk. When they brought me, my husband and my daughters didn't want to send me to a recovery place. So they told the hospital that they want me at home, that I was going to get better at home. So when they brought me in an ambulance. Very hard when my husband saw me because that was the first time.
Right, they had not seen you in a month. So what was that transition like back into your quote unquote normal life on you and on your family? What was the impact of that?
It was very hard because we were still scared that I could bring COVID to them. So I didn't want my daughters to get close to me or anything, even though I was in the house. I was in the room with my husband wearing masks, and all the therapists, when they were coming, I was in diapers because I couldn't even stand up and go to a bathroom or anything. So PTSD hit me very hard.
And I was going to ask you about that because we hear about post-traumatic stress disorder if someone has been in a war or some just huge traumatic event. But this was a war inside your bodies.
Oh, yes. And something that as of today, I hear an ambulance and I get very nervous. The other day I was in a store and the lady was doing some inventory and the machine was making that noise, and it brought me back to the hospital when the machine that you have, it's taking your blood pressure and it's taking all that, and I had to leave the store.
So what are you doing about that now? Because we often don't want to talk about the emotional said that word twice because it needs to be said twice, toll on not only us or our family. And in some communities, the Hispanic community, African American community, and others, therapy or getting help in that way is just not something we do.
That is a very great point to bring out. I will not be talking the way that I am talking if I will not have the help of a psychiatrist and a psychologist. It was very hard because you first think that I'm not crazy. Why I am going to receive one of these services? But it's not about being crazy. It's helping you to cope and teaching you skills that you need. I could not sleep, so I have to learn. I didn't want to take medicines to go to sleep, first of all, because I came out of the hospital with high blood pressure, the diabetes exploded, a lot of other things. So I said, I don't want to add more pills into my daily life, but I had to learn naturally how to release myself, how to calm myself, and to know that tomorrow it's going to be better. That tomorrow was very important for me.
What do you worry about now?
I am still in moments that I forget things. I am not the Maritza that I used to be yet. Okay. I am in that road of getting there.
What part of her do you want to get back? You said you're
energy,
not.
Okay. Energy, and sometimes my mind, my remembering things or remembering names. It has been a big challenge for me. Faces I will never forget, but names. And even sometimes I tell my husband let's talk about the past so I can bring that into my brain computer. I have been like rebooting myself.
I love that.
You know, I am rebooting myself because there is things that I don't remember. There is things that I don't want to remember too. Because the things that happen in the hospital in those days I remember I had a physical therapist that used to come to the house, and he used to tell me, I am not going to feel sad that you cannot walk. You're going to walk, and you can walk.
A little bit of tough love.
You know, the tough love.
Yeah.
And I appreciate now that, but I used to tell him, I will never remember your name. I don't want to see you. But I had an OT lady that...
occupational therapist.
The occupational therapist that she was so awesome because she will come even with the tough love. She will always say, you have to walk straight and let's do this, and that motivation. And I think that is something that because of what happened to us, we cannot stay on that. We know that there is a tomorrow, and I remember that when I start moving the first day that I brought up my arm up to here, for me that was the biggest challenge that I won, you know? And I start talking to my body. I used to talk to my legs, to my hands, and say, you can do it, Maritza. Let's do it.
So what would you say to people now who may be watching this and go, I had no idea? What is the message that you want people, not only in the Hispanic community, but
everybody,
anybody and everyone who's watching, what is the message you want to leave them with?
The first message is to get vaccinated.
Okay.
You have to get vaccinated. You know, it's like, I know that for some people it's a very tough decision, but you have to get vaccinated. And once to understand that this is real, because people tell you, why you're still wearing your mask? Because this is still real. I don't want to go back into the experience that I have. But it's about educating and helping the community. And sometimes I had the experience in my neighborhood. One of my neighbors, we didn't saw her for a few days, and I told my husband, I said, something has to be happening there because I haven't seen her coming out or anything.
So now you're checking on
people.
Yeah,
And
just check on the folks that you love, make sure they're okay.
And give them that, I think that the hope and telling them I care and let's work this situation together.
I think that is a perfect place to leave this conversation. Maritza, thank you for being so open and candid. And you're still leading and serving.
Thank you.
So thank you for being here. For more information on Latino leadership, visit latino-leadership.org. We will be back right after this. COVID. Just a few short years ago, it's a word none of us, the majority of us, had never heard. But now it's clear its effects are going to be around for a while. And you're going to have questions. We're here to get those answers so you can keep making healthy connections. I'm Annetta Wilson. Thanks for joining us. We'll see you next time.